is Christine Seaman. I am a current Master of Public Policy student at University of California, Riverside, and I'm going to be talking about the health of unsheltered homeless populations in Riverside County heat. We're going to start with some definitions. Folks may be asking, where is Riverside County? So Riverside County is in the eastern southern portion of California. It is closer to the Arizona side behind Orange County and is home to about 2.5 million people. In terms of what unsheltered means, unsheltered refers to any homeless or unhoused individuals who are not living in a shelter per se. So this could be a hotel, this could be living at a friend's house, this could be living in a designated temporary shelter. Those are all what is referred to as sheltered homelessness. So unsheltered homelessness is going to be the folks who are living on the street, folks who are in parks maybe, and folks who are living out of their cars as another example. So the reason that I wanted to look at the health of unsheltered individuals is that we are currently seeing an increase in extreme heat events in Riverside County and in the United States as a whole. So an increase in extreme heat events occurring at the same time as an increase in unsheltered individuals creates this sort of combination of needs crises that the current social and medical services we have do not have the capacity to manage effectively. And with that being said, conventional heat wave preparation methods used by individuals with secure housing may not be accessible or even applicable to those who are unsheltered. So this would be like air conditioning as an example, or a cold shower. So Riverside's climate increasing in temperature, especially wet bulb temperature, with a disproportionately high level of unsheltered persons means a very high risk of harm to these vulnerable groups, as well as a strain on already stressed medical and social infrastructure. So the county should invest more in preparation for these events and keeping unsheltered persons cool and safe. So here we have a graph from the Riverside University Health System that shows the heat trends and emergency department visits over the last few years, measured by week. So we see here that there is a sharp spike in 2023 and 2024 with over 150 emergency department visits over a few consecutive weeks. And this is important because unhoused individuals are more likely to use emergency services due to a lack of access to affordable health care. So most folks will wait until a health concern becomes an emergency and can no longer be put off. So this is an issue when we see that folks who would not normally use emergency departments are getting more heat illness at the same time as unhoused and unsheltered individuals. So here we talk about some environmental justice issues. A health of unsheltered populations is an environmental justice issue. And I found during my research that a lot of the times with increased policing, unsheltered persons are pushed into areas with higher urban heat island temperatures due to these sweeps and harassment. Which means that they are also going to be facing barriers accessing cooling centers, such as a lack of transportation and a lack of nearby social services. In addition, a lot of folks who are unsheltered who are pushed into these areas prefer to stay in their tents or stay in their cars without having any windows down for personal safety and fear of violence, which can lead to increased overheating. So this quote you see here on the right is from a study in Santa Clara that found very similar results. And they went into how severe the policing issues are in that county with pushing folks into those areas. And it's very similar to what we're seeing in Riverside County. So here we have on the right, we have a map of surface urban heat island intensity and average income over a 5-year estimate period. So we can see here that lower income areas are mapped to similar areas as intense surface urban heat island effect. You can see that red area right there corresponds with the lighter green area that determines median income. So some examples to aid in adaptation that I would like to see that were discussed during the study are focus groups with unhoused individuals, especially unsheltered individuals, as they are not included in a lot of disaster planning. It is important to include humidity in extreme heat warnings, not just temperature, as humidity affects how folks sweat and how that heat can be evaporated off of their bodies. We need more community outreach into areas where unsheltered persons are staying, which is similar as this Be a Buddy program that we're seeing in New York City, where folks are paired with social workers and medical teams to check in on elderly and more vulnerable populations. Obviously, not criminalizing homelessness itself in lieu of expanding shelter access would be a key policy feature to implement to keep these unsheltered folks safe and cool and prevent any further harm. Another thing would be mobile medical clinics and free clinics. And yeah, I'm going to open any questions. Thank you so much for your time.